Okay, tonight's topic is senior services in the home, such as, like I said last night in the other video, attendant care, um, like it's also to show them what else is out there after they transition, like meals, meals that people can get delivered to them. Um, you can even set up therapy services, in home nurses, like visiting nurses, um, do like for case in point for a client who can't get out of the home for some reason or another. You could also do video conferences with their doctor, via via video chat if someone knows how to use a computer, or if an aide can set up to help them. Maybe that's what their personal care attendant can do, is help them set up the video feed for a doctor's visit. During pandemic, that's what people used was video teleconference. Now that's not. I mean, it's most. It's like this the same visit to your doctor, but in the safety of your home. In the case of the pandemic, people do that. People did those uh, strictly because of not wanting to go out in public for everybody has like reasons why they can't, why they don't want to do public visits. Some of the seniors have a harder time getting out of the home, even if they have attendant care. You still have a problem with finding transportation for them, setting up like like in some instances the community has like a lift bus. Okay, with a lift bus you have to call ahead of time. You have to like call 24 hours before your scheduled trip. um like and that's nice because you can get some bus companies will let your attendant ride for free. It's called share ride. Bus will come right to your door, pick you up for a shopping trip or church or to visit family. But you have to schedule those in ahead of time, like 24 hours. Um, and also now the grocery stores are adding um like you could call and order your groceries and somebody will come deliver them, which is nice if a person's not able to get out. um like but you have to take when you take a person out of a nursing home, you have to plug in those little community pieces. You have to make sure those are in place for your clients. um you as a transition specialist, those are extras. Those are not a given. You have to do like I said like I said earlier in the one video, you have to do some digging. You have to see what fits their life in order for you to plug in them services. So sometimes you have to sit down and do a detailed um like in that month you're supposed to in that month that you're allotted, you could sit down and do a detailed list to see what community services they're interested in being hooked into, because again they can customize that too. They can customize, they can customize that as well. You have to fit, you're you're there for a month to help them fit their life so it will run right, um so that they have the extra support. Some clients like to go out by themselves and do it. um freedom's nice, but they also have to have that equipment I said, like in the previous video also. You have to make sure that things are set up for them to function, like I said. Like extra details, like case in point for like supplies, because like I said the other video, you have to make sure they have those extra supplies also. So what you do during that whole month is you set up a day to go in their house after they move out. You set up a day to go into their house and sit down with them and help them plug in those extra services. Because, like I said, some companies don't have that. Sometimes you have to call around and see who's willing to give that kind of service to your client. Sometimes you have to do a little figuring to see what fits. Sometimes you have to do home modifications for them. Like, let's say, for example, person wants to move out. Person comes in the facility in one piece, but because of rehab or breaking a leg or maybe having a stroke, they're not, they're the same person, but they're not physically able to function as a normal person. So you have to figure out what how you can help them compensate. Out in the community, it's a lot easier, but you have to find a company that's going to have like equipment for them. You have to see who's going to help them out the best, where you can get the best deal for um their coverage for their health, and like whatever health insurance they have, you got to make sure that it also has coverage for their equipment. Like, if you have to, you help them out. You can help them out, make phone calls with that extra month. um set it up as much as you can to fit their needs. Like, you can have two or three agencies come in and do something for them. Like, for instance, if someone has a wheelchair, obviously they need a wheelchair company to come fix their piece of equipment for them. That holds true for a bed too. If you have a hospital bed, most wheelchair companies offer hospital equipment to come in the house. Um, Sometimes if person has like an inhaler, a nebulizer, well, the nebulizer needs hosing. So you have to find a company that also offers that kind of deal. Um, I also deal, sometimes I also deal with people that have companies need a detailed list of stuff that you need for, like, if someone comes out of a nursing home, the company that's servicing them, if they have a company that's dropping off equipment that night after you move them out, they need a detailed list as to what they need to bring. Um, so that's when you use, like I said earlier, that's when you use the time, the extra month that you have. But in that month also, you could also do pop-in visits for that kind of reason also. Um, so you can fix it's like using, my analogy is having a quilt. Each little piece of each little piece of um, quilting that you use, each little square that makes up the whole blanket. Your goal in life for your client is to make sure they have a good blanket. Um, it may, like I said, you may call around a few times. Each place has a different. Each place can service a person differently. Like pretty much, you they have to go out for doctor's visits, but I'm like, if they're sick or something, they can use they can use a um teledoc or telemed for that. If they're too sick to go out, but they still want to talk to their doctor, they can you use a screen for that. Like I said, their attendant can help them set that up. You can still be in the same room with them, but when they have those kind of conversations with be it on a video call, um, you could still step out and find something else to do while they're on those kind of calls. But that's an outreach issue. Um, you they can use the community services. You just have to find the right ones, like I said, the boss, the grocery store. That's the major ones, the major grocery stores around. Um, mostly have delivery services. Um, and even if they don't, I mean, depending on how the person wants to set up their community services, your job as a nursing home transition specialist is to make sure that it's written down somewhere that they can access it, and you have to make sure that it's written down big enough so they can see it. Um, because those kind of details, they're at the end. You know, it's at the end of your service with them. But like I said, you have to sit down with them that extra month that they're allotted to make sure that if an aide can't show up, uh, and that's another issue. After community services, you could use the extra month as to help them set up, uh, maybe fill in aides. Um, make sure the company has that option to have an extra aide come in if someone's sick. Because when you get a client out of the nursing home, like I said, they're not they're not used to that stuff. They're used to having somebody come in their room when they push a button, and making sure they have the community support is a big real big necessary detail. The necessary detail is, like I said, You got to make sure that the package is neatly tied up. Now, like I said in the other video, you can make they can make calls to you and ask you for to come help them with little details. Those details could be taken care of over the phone, or those details could be taken care of in a home visit. Um, and tonight's video also, it'll delve into the senior the if you take a person out that is a senior, like I said, they're wanting to stay home and enjoy their apartment, meaning they're happy by sitting in there, setting it up, sitting in there. So home based, um community services, maybe show them how to use the bus system calls. Maybe maybe show them how to use the call system for bus, because I guarantee you, when you get a person out of a nursing home, you have to show them how to, like I said in the other video, you have to show them how to live their life, um, using bus transportation, using pharmacies. You know, make I'm sure the pharmacy wouldn't mind calling, if you help them call and say to them, um, could you take the time to explain to my help me explain to my client how to use the phone system for ordering my pills. Or if you're good, and like I said, if it's a person that's done it for a while with them for nursing home transition, you show them how to do that kind of stuff before you leave, because some of them are scared to use the phone. Some of them are scared to do it for themselves. So what you do is you sit in the room with them. You be their support. Like I said in the other video, they can do it. They just need the confidence. They have to see that kind of stuff come from you first. They have to, like, when you are doing, let's say they go from the nursing home to an apartment, but they don't know how to fill out an application. During that time, also, you have to show them how to fill out an application. Um, some people have their house to go back to, but again, maybe it needs modifications. So you've got to show them how to set that up too for modifications. You have to make sure that they know how to ask for that kind of stuff. And if they're filling out a housing application for the first time, you have to stop in the middle of doing something and go reinforce that. Go over it again. Go over the same paragraph again, so that they understand how to fill it out. Um, like I said, they're happy when they get out. But again, you got to show. Different communities have different pieces that they can plug in. Um, like For example, when towards the end of transition, you can take them out in on the community for like a lunch date between you and your client. You can gauge a person how they function in a public setting if you take them out to lunch or shopping. Like I said, towards the end of the process, you can take them out shopping and see how they do in a store. See how they handle it, and if they ask you a question during the store, stop and answer it. Stop and make sure you take time to answer that kind of stuff. Because it makes it it makes them feel better because the focus is on them. The focus isn't on a nursing home. The focus is on them after they see what you're like. Community based services, like you have to plug in to things that they need. Like I said, medical supplies, in home nurses, um, different agencies, um, like different agencies offer. Some of them offer in-house doctors, which is nice. Some of them, if you hook them up with attendant care, some of the companies that you hook them up with come with community-based services, um, sort of like daycare, community outreach. It's like senior centers. Those are great. Senior centers, get them out in a group setting, be it for the day, for a couple hours a day. Um, Person may choose to go maybe once a week to the senior center. If they can't get out, if they can't get out of the apartment for one reason or another, but you move them out of the nursing home. That's the goal. But the community services have to come into them. Like you as a transition specialist can also set them up for Meals on Wheels if they have a hard time cooking, because it takes time to get their services plugged in. You know, it takes time to let things, yeah, get plugged in after. Because when you get somebody out, their whole goal is to be comfortable in their apartment. Okay, that, like I said, that takes a month, and then they call you and ask you, community services. So if they call and ask you, your response to them should be, okay, what do let's have a discussion about that to see what you're wanting to use. You get them a list of what is out there, as much information as you can before you move them out. um, like community based services, grocery stores, places to get their equipment through. You find out what insurance pays for what. You got to make sure this stuff is tied up. Um, but like I said, for doctors and nurses in home care, um, it's the same for physical therapy. It's the same for PT, OT. They come in the house too for clients. Um, just depends on how they want to set things up. But you have to ask them for that, for community services. You Um, oh, and then seniors are concerned about their cost. If it's going to cost them anything for that kind of stuff. Each agency, most of the time, it's covered by insurance, but people, seniors do worry about, do I have to pay for it? How much is it? In-home health care comes with a nurse. Comes, like I said, visiting nurses. They're great for people that have issues, but they still get out for groceries, but they have issues going going to the doctor. So you have nurses come to them for care. Um, Places that offer that, some places have their own doctor, and plus they cover the clients lift chairs, anything they need, like hospital beds, um all their, some companies, they keep all their services in house, meaning you can go there, hang out for the day, like almost like adult daycare. And let's say you go spend the day, at their place of business. They provide you free lunch. But during the pandemic, it was a lot. It was a lot for people. Agencies had to service people. They still service people, but they brought things to their house, their meals. For senior centers, they brought them things to hold them over. So home home based services for seniors is like I said, if it's done right, it's rewarding. It's rewarding to see them function as people that we, um, as much as they could function, they function with the right supports also. And then some people, they go to assisted living. Maybe they can function on their own, but their services may need just somebody to pop in and make sure they don't need something. Just popping in. But assisted living also is another option. Um, but like I said, if you set the home up to where they can function with the agencies that they pick, it works well. Um, the second issue here is if your client has to have diabetic supplies delivered to the house, you have to find companies that are willing to do that also. Um, with Now, the difference between the personal care assistance and companionship. That's also in this video. Um, Personal care means dressing, bathing, um, bathroom, basically your daily living skills. That's nice to have for them inside the house also. Um, companionship. Companionship means that, like for an older adult who doesn't need medical care or regular help with ADLs, companionship services can help them with the loneliness, because I guarantee you a lot of those people are very lonely. Um, let's see, maybe their attendant can take them out for like a ride. If their agency, if the companionship agency offers that also. Um, home health care, in-home healthcare services also means, um, specialized care comes to them. Like if, for example, if someone has a wound, let's say they have a wound that won't heal, and you set them up with home healthcare based services. Um, their agency has to have a nurse that is specialized in wound care, which is nice because they'll come in and address the wound for the person. Um, like I said, it's different. Each agency is a lot different. Um, let's see. Bear with me a second. Oh, elderly people, and let me give you some insight as to how they feel about um, in home based care. They're more comfortable with people coming into their house, with with the therapist coming to them instead of having to get in the vehicle, um, go out, do their session with the person, and then come back home. It's a lot better if someone shows up to their house and does it for them. A couple days a week. Let me see. Fair second. Oh, and when you when you see a client of yours needing extra support, let's say you see it the month before you, the month that you, the in the aftercare session, you see that person needs more, a little bit more support, a little more help. Okay, so let me go into detail about that. um common signs indicating a need for in-home care services: change in habits, falls, um, shakiness, um, maybe maybe you're their attendant and they don't want to go out anymore. They still want services, but they don't want to go out anymore. So, like I said, they the second half of getting somebody out is that the services have to be added to, and like I said, it's much easier if you do that during your extra month. Meaning, because they like to see your face anyway, but it's easier if you do that in your extra month because you have more time then. And sometimes people attach that on the transition reports. That's the way I used to do it. I used to attach it to the transition report. To seriously, you have to make sure that it is a detailed exit plan. The extra supports, the community services, the outreach has to be put at the end. I mean, almost the last minute. Not necessarily the same. Not necessarily the day of transition, but you can use it for the month that you have with them. Um, you have to see what they're willing to let you do. Oh, and the more community-based services you give a client, um, the point of depression goes down too. The point of depression, that happens when people don't have enough out community-based things to do. Some people love some people love the feeling of being out, but after that dies down is what you have to worry about. And before you let them go as a client, you have to fill that hole. Remember, I said there could be holes in the services. That's where you put um, the extra support, the extra agencies that you line up. You and your client have to make sure those are lined up. The ones that they want to use for extra services, Meals on Wheels, um, nursing, home-based nursing. They come in and do a separate detailed list also, because it's a separate agency, and the separate agency will come in and do their nursing assessment if the person needs nursing. Now, if you have a client that's a diabetic, yeah, I me as a person, I would suggest I would suggest having um in-home nursing. Now, that doesn't have to be attached to your attendant care. This is a separate um, agency that comes in and takes care of giving them their insulin. That falls under a visiting nurse. Now, I've seen it where some of my clients that I had before, um, let's say they accidentally get injured and have to go back into facility. Now, if your base services are great, they can get fixed and then come back out. But maybe when they come back out, they have something else added to their care plan. That happens every time someone. Uh, when you get older, as a senior, you have more needs, and your care plan gets longer as you get older. But again, some people won't tell you. You have to figure that out for you. You have to figure that out also. But that's an issue you could deal with as a later point. Um, let me see. Oh, it also helps if you have all their community services neatly packaged in one notebook. Contact numbers, bus company, visiting nurses. For example, there's different community services that offer agency doctors that are attached to companies. Um, yeah, they could, a client can use those too. But if your client is a senior and wishes to stay at home for their care, you know, they also can have the same setup as a person that has personal care services, and they can plug into the people extra community services that will um, bring them a meal for the day every day. It's Meals on Wheels. Uh, a person comes in with their meal. Joe Blow sitting at the table when the person comes in, brings their meal. Hot meal comes with a home visit from from the Meals on Wheels person. Most of their health care can be taken care of at home too. Nurses can do vital signs and um, pretty much medications. Um, Visiting nurses can also help a person recover from surgery. Uh, Basically, you can take um, things that are usually done in a nursing home or hospital and put them in a house. Set them up so they can function with a therapist. PT, OT, um, you know, uh, people need the extra supports in the community. Also, like I said, everybody doesn't know about those, especially people that are shut in nursing homes. They they're relying on you to tell them, or they might find it out by hearsay, by another person telling them, "Hey, this agency does this. this agency that, this agency is good at that. Um, like I said, it's just like shopping for furniture. You also have to shop for your in-home services or community-based, um, things that you plug into them for. Senior centers are great for your clients that can get out. Because, let's say, for example, you have to ask what they want to do, for spare time. Um, because once they get out of the facility, they're not gonna know about, like, they can go to senior center and play bingo, go on shopping trips as a group. Um, but so towards the end of the transition, go over that kind of details with them for in-home or outreach services. Because then they're not going to know unless you tell them. So, my advice to you as a transition specialist, also make sure they have the community support, community supports. Because I guarantee you that if you sit down and make a list of what they like to do, bowling alleys, they have ramps for bowling for disabled. Um, maybe get them plugged into a senior center. Get them plugged into like someone to bring them groceries, or tell them where they could get that before you leave them as a client. You got to make sure that that the person knows what's around them. Make a couple trips out of a facility before you transition. A couple dates between you and your client, and to see how they function in public, because they're scared the first time you take somebody out, they're worried about how society will look at them. So, do it in that space of time that you're allotted for getting them out, hooking them up with community based service, like, because that matters for them. They don't. I mean, they need to know about the what's out there for them to plug into. So if you get the phone call from Joe asking you, which, was what you can do is go over go over with him or her, like, take it with you on your next to last visit. Take them a list of extras, a list of extra things that are based in the community they can plug into, where to go for certain things. Oh, and it helps out if you show them where a grocery store is, if it's closer to their apartment. Um, so they could take with their attendant, take a ride in their wheelchair, go to the store, um, go out to eat. Uh, you know, because the whole point of getting somebody out and setting them up so they enjoy their life. That's also using That also includes using the community based outreach programs too. Because, like I said, if it's set up right, it runs right. And like I said, seniors like being they're comfortable in their houses. They like the in-home services. Seniors, they have to make sure that they have all of this plugged in too. So if you help like a senior citizen out of a nursing home transition, it's good for everybody. But senior care is based on what they want as a senior. It's based on how that fits into what they want as their life. Any other section of theirs tonight is also going to talk about how people use their services towards the end of life too. Um, like when someone is real sick, to the point where they have a doctor, but they don't want to go out. And you set them up with an agency who has that option to have a doctor come into them, or have the agency that they're tied into, if it's like a real good one, they'll have a van come pick them up and take them for their medical visit and bring them back home. That's very nice for seniors, so they don't have to worry about driving. They don't have to worry about falling. They don't have to worry about breaking something. Um, that's a that's a that's a plus. That's a plus on their part if they can get all their services to come into them. Yeah, it also works for a person with no with limited mobility. Meaning that if a person still can function but they have limited mobility, um, it's also nice having everything set up for in-home based services. Uh, oh, and then having somebody stay in their own home, a senior stay in their own home, it's a lot cheaper for a person to get care. Now, it's the same kind of care, but it's for the lesser price tag. It's better having somebody in their own home. It Because if you're in a facility, after 30 days they start charging you for toilet paper, for soap, for little details like And they offer, let's say for example, you go, they go for um like salons. Some of the nursing homes have places where they can go get haircuts and stuff, but that's extra. That's not your basic care. So the best thing is for a person, for a senior citizen, is to have home-based care in their own home. Um, and this makes sense too, as when they get towards the end of life, they all they want is things. They set that up themselves also. How they want to live out their last ones, live out their last days. Um, which is nice for person that you go see too. It makes a difference on how they want to spend the rest of their life. Uh, like I said, you get attached to your clients when you get them out, and I've seen people where they just they they want things a certain way. They want to experience getting out and having their own place, but like it's a short-lived thing for them. But if you have enough supports in place for outreach for them to get to, it makes their life longer. Me as a person, I see people that have the extra supports after they get out. They tend to they tend to live longer. Um, Now, remember what I said about some people asking about how much it is for costs. Some of the agencies have that listed also for people, but when you transition somebody out that needs the extra supports in the community, like I said, it's a that is a place where you have to sit down with your client, see what they want to do for certain situations. Like I said, let them. You're there with a piece of paper before you let them go for the month. Let them come up with it. You sit there and structure it for them, but let them tell you which agency. You hand them the list of agencies for community-based outreach. You let them pick, and then you write it down on a list, and then help them call that agency. Your role changes after that. Your role changes as a service person. Your role is like I said, remember when I said in the last video about having a safety net? Instead of seeing them every day, you see them like a couple times. You take their phone calls and fix things through phone call. And then you get to pop in if the person says, look, can you come over and help me. If they need your help later for for community based services, uh, be there to help them. Um, the extra outreach, extra agencies help with the mental. They help bridge the gap between the the depression your client feels. Having the extra support, the extra community based services that you plug them into, helps them function like a normal person does. It lets them have enough in their life to get out and socialize. Um, it helps them if they have an agency that you plug them into with the option to come get them, pick them up at the house. Let's say they have like 3 or 4 people in the van at the same time, and they're going to the same event, same shopping center, same restaurant. That bridges the gap between the loneliness that people feel. What you don't want to do is have your client have that. You want to let them have as much uh, outreach services as possible, like bingo halls. One of my clients likes to race RC car. One of his transition requests was to go get an RC car. I went because that's what he likes to do. I didn't get a chance to go to the track or anything, but on his transition plan when we went shopping, he picked some of the RC car parts up so he could put a couple together. He was all excited about that, which made me, like I said, it's rewarding when you set the right um, services up for people. Now, for the first couple times with a senior, yeah, maybe they like to go bingo, so you set them up with a visit to the bingo hall. After you get somebody out, like in the month that you're with them, help them make this kind of connections before you leave them, and see how stop in after your month of service. Stop in and see how they're doing. Because after transition, you become a friend of them. So stop in and see how things are running. Um, after you stop in and see how things are running, um, if they ask you to add more to it, you as a person can help them also after that. It matters on how you set somebody up with community based services. Also, um, and if they don't like something, they can call the agency and change it after that. Um, Long term, for let's see, there's another thing I want. Let's see. Give me a second here and make sure I went through everything. Okay, but so yes, it matters how a senior wants their services also. And if they're now you can give a person too many outreach or too little. Now there's a fine line between that. Um, Fine line between giving a person too much or too little. It's sort of like um the three bears. You have to try and see what fits for community outreach for them. Um, if something isn't working for their outreach, and they call you and say, "Look, I know I'm not a client anymore, but would you please help me, redo something?" If you're the good person that you are getting them out, um, you're you're going to tell them yes. You're going to make time to do that for them. Because again, how they're set up in life, how things are set up matters, because it's a reflection on how you do uh, as a transition specialist. That happens for a senior adult too. Um, senior Seniors are a lot more detailed. They they require more services. Um, like for instance, um, if they have their own house, and they're in a facility, but they're getting out with your help, they they may need your assistance signing them up for LIHEAP, for heating, and for them to have their heating on so they don't freeze. Um, they may need the extra um, pharmacy that delivers their pills. They can call and get them delivered to the house. Um, it it makes a lot of, and then it's there's also another side to that. You got to base whether um, there's a difference between long term, short term, and home based care also has that same comparison. The home based care, as far as nursing goes, they can see them for the rest of their life, or they can see them for 30 days for short term, I mean. Um, short term means like the doctor writes out a prescription for PT to show up at the house for like 30 days. That's short term. But if a person needs that to function for the rest of their life, that's a long term thing that you have to put in place. Um, Long term, your attendant care for company. What's nice about having a long-term company that does home visits is maybe they're connected to hospice care. Meaning the same person that comes in for the attendant care can also do the hospice care. Um, I've seen some companies who offer that as a service also, for the senior. Um, um, those are those are some special people that do that. Um, the senior, maybe they're used to being maybe they're used to being in their own home. Maybe they go into a facility for 30 days for like a short stay visit, and then they choose to have end of life care at home also. End of life care at home is possible, but again, you have to find companies that offer that service. It's they Some companies have their own hospice. Now, for that, depends on the company. Um, some companies offer that, and some companies are afraid to have that option. Now, when they're afraid of having that option, that just means you have to dig some more in detail and find an agency that is willing to come in and do what the client wants at the end of life, because it also when you are at the end stage, all you want is to go in peace. And part of end of life care at home is having nursing who offer palliative care come in for you to have that kind of service at the end, because most seniors don't want to leave their house. Oh, they get angry when they have to leave their house. And they like it when people come into them. But, you know, you as a person, when they get out, you have to look at that down the road also for them. because it matters. It matters. Now, some of them, when it comes to care at home for them, for the seniors, they're all worried about what the outcome on their families is going to be. So when you have to go see somebody about getting out, um, home-based services, they're great, but like I said, you also have to consider um, what they want for like end of life care, because some of my clients that I used to have, they they get out of the nursing home, like I said in the video, they get out of their nursing home for just to go pass at home because they don't want to. They It's too much money to go in a facility and pass. It's much cheaper letting somebody set up what they want in life and use the services until they can't anymore. Um, Hopefully, it's all based. Community based services are there to help you support yourself. Meals on Wheels is so people that can't cook anymore can have a meal brought to them. Um, Maybe the person's blind or something, so it becomes a safety issue. Um, you know, it's all how a person that's a senior uses that information that you give them. Senior care for people is based on what they want. It's like I said in the previous video about personal care or agency model and personal care. They're a totally different ball game. So setting up a person that that is a senior at home, sometimes that's age based. Sometimes that's based on what they can do. Sometimes that requires a reassessment done. When you have to add more services to their outreach, that requires a different assessment done to see how much is there. And the best thing is when you're doing that for someone, um, bring in the aging offices. Bring in the aging offices so they could come in and do a reassessment for your client. Because as the process goes on for a senior citizen, the more supports have to be added, but you have to do that in steps. You have to do that in like for that analogy I'm going to use, like having stairs put in your house or building blocks. Each stage in life, each time someone gets older, They may have to increase services. A person that gets out of a nursing home, um, or has home care coming into them may need to add more because of losing sight, because of losing balance. You have to add more equipment when somebody loses balance. Um, when someone is losing their ability to function like they want to function, um they get worried about adding more adding more things. They're worried about states taking some of their stuff away if they don't use it. They get agitated if it's not if something isn't there that they're used to being there. Um, like for example, if they're used to going out and having having time to themselves, and they're stuck to using home-based services for their care, to add to their care. Like for example, if someone's used to driving and they're they get that taken away from them because they can't do it anymore, then you set them up with someone to come in and take them places. But again, they're not used to it, so then you have to sit down with them and uh, detailed explain to them that they can still do said activity, but this is how we can help you do that. Go shopping, because when someone uses the community based bus or service, like the agency comes with a van to pick them up, they feel guilty about losing that service or losing that ability. So when a person has a van come get them for not being able to drive, you nicely have to explain to them they're still here to help you. You have to reassure them that it doesn't necessarily take it away. It's just added to make their life a lot a lot more convenient. And then when you have a person who has to stay in their home that isn't accessible, person likes to stay in their home, but let's say it has stairs. So then you plug them in with a company that offers a stair lift or a ramp, but you have to get their mindset set in that set for that situation. Like just like when you have to get their mindset about leaving a facility, you have to get their mindset wrapped around using using the services that you help them plug into. Um, because some of those people, um, after you set them up with the community-based services, some of them are hard to accept those. You know, when somebody loses the ability to drive and has to have a van come get them because they can't drive anymore, that's a major blow to their lifestyle. So you as a person have to explain that to them before they transition out. I hope tonight's video has helped somebody. Will explain to will explain to clients that because we add more to your services doesn't necessarily mean you're going to lose them. It just it just makes it a lot easier for you to call somebody and say, hey, I need a ride somewhere. Make sure, we just want to make sure you can function with those right proper supports. That's another support that people have out in life is the extra van, the extra nurse, the extra therapist. Um, some people, when they transition out, they may have equipment added to them so they can come out of a nursing home, hospital, or something. But your client has to realize that their equipment is also extensions so they can have it. Some of them get angry because they have to use that. So your your job as a transition specialist is also to get them to see that those are extra extensions so they can function well, not be scared of using not be not be scared of using community based outreach. That is so um they're not they're not they're not scared of calling for someone to come visit them for a nurse visit. Some people get some people don't want to use those, but again, it's based on what kind of fits them so that it's safe. It's a safety issue then. If you take and have a blind person move out, they can still move out, but they need the extra support from the community to do so. I mean, they have attendant care, yeah, but they have to have like things brought to them. It's a safety issue also. You you as their transition specialist, you have to make sure that they understand that using community based services uh, out in public is good, but when they have to be home, you have to explain to them about extra people coming into their house, extra people showing up to help them support themselves. I hope tonight's video has helped somebody um, understand about seniors and having extra things for them to plug into also. If, like I said, like, share, and comment. If people have any questions about things that I post, like I said earlier, I'm okay with answering questions. That's why I make that's why I make these videos. That's exactly why I have this channel set up, so I can answer stuff for people. So I mean, me as a person, I like to see a senior citizen who can still function, but they can also deal with the limitations they have by accepting their services, because a person has to accept their services for community-based care to work. Extra supports, they have to accept extra help. So if you involve them setting that up, that makes it easier for them to accept it. Now, if a person goes and sets it up without asking, then that's a whole different ballgame. So, but when you set them up with the extra supports from the community, sit down with them, ask them just how you want to set up your extra supports. If that means taking extra time with them for a visit, do so, because that also makes a difference on if they're going to go use that or not. It gets them out, gets them to socialize. But again, after you leave them, after the month that's allotted, and you leave them with their services, it's how they choose to use it. So my suggestion to you as a transition person for them, make sure they're okay with how they set things up. And my other suggestion is when you're figuring that out with them, use a pencil so you can erase it, put something else in place if need be. I mean, person has to be open to change. Like if someone needs something taken away, and something else put in place, before you do that for someone, sit down with them and ask them how they want to set it up. Because that if you ask them to be involved in setting it up, setting up extra outreach, they're more apt to use it. It's not gonna be thrown in. It's not gonna be like, oh, I'm not gonna go for that, or they're gonna be wanting to go. They're gonna be wanting to go to the senior center. They're gonna be wanting to interact with other people. They're gonna want to be out doing stuff. They're gonna be wanting to do it if it's set up right. Hope this has helped somebody understand about adding outreach for their clients, aftercare, because that's the whole point of tonight too. So thanks a lot for watching. Remember to smash the like button for me. Remember what I said about people leaving comments. If you have any comments about tonight, I'll be open to answering. This is Gator Wellness signing off for tonight.